Thank you, Madam Speaker. I'd like to start this debate with this. Dead people don't detox. And I want in particular for the Liberal and Conservative members to let that sink in. I want the Prime Minister to know that his excuse that decriminalization is not a silver bullet is a false argument to deflect his lack of courage to take meaningful action to save lives. Let me be very clear. Overdose deaths are a preventable death. People are dying from drug poisoning, and it does not have to be this way. The passing of Bill 216 will save lives. It is within the power of every member of this House to show that you value life without just judgment, that you want to stop the overdose crisis in your community. And all you have to do is to vote for my colleague's bill, Bill C-216. It is a bill to decriminalize the possession of a small amount of drugs for personal use, to expunge the criminal records related only to minor possession convictions, and to work with provinces to find health center solutions to end the crisis once and for all. These include ensuring a safer, regulated supply of drugs, providing universal access to recovery, treatment, and harm reduction services. The overdose crisis has been wreaking devastation upon families and communities for years. In BC, the toll has been the heaviest. 2021 was the deadliest year yet on record for the number of overdose deaths, taking 2,224 lives too early. Since the overdose crisis was declared a public health emergency in 2016 by the provincial medical health officer in BC, more than 9,410 people have died of illicit drug toxicity. Just last month, there are 165 suspected drug toxicity deaths in British Columbia. That's 5.3 deaths per day, and it has become the leading cause of unnatural death in British Columbia. In 2018, there were 4.5 times more overdose deaths than deaths from motor vehicle crashes, suicides, homicides, and prescription drug overdoses combined. Overdose deaths occurred across all walks of life, age groups, and socioeconomic spectrum. Parents of judges, of doctors, of teachers have lost loved ones to the overdose death crisis. And I still recall the heartbreak of a mother whose daughter got ill and needed surgery, and afterwards, her daughter got addicted to opioids due to the overprescribed painkillers. And when the doctor stopped that prescription, her daughter turned to street drugs to manage her pain. The pain and anguish on her face when it was revealed that Big Pharma hid the addictive nature of opioids. I cannot imagine the devastation of a parent reeling from the shock that their child, a high school student, died of an overdose. Madam Speaker, I know too many people in my community who use drugs to help them manage the trauma they experience, and they are just trying to survive the best that they can. But that should not be a death sentence for them, Madam Speaker. I know too many people who have lost their loved ones on the drug poisoning crisis. Madam Speaker, 9,410 since 2016, 2,224 last year, 5.3 deaths every day. These are not just numbers. They are real people, a son, a daughter, a friend, a husband, a mother, a loved one. That's why we must stop this war on drugs. It has failed dismally and has done more harm than good. The Liberal government like to say they believe in science and medical experts. Well, believe it when BC's Chief Public Health Officer, Dr. Bonnie Henry, recommends that the federal government decriminalize people who possesses controlled substances for personal use. The Conservatives like to say they believe in law and order. Well, believe it when the Canadian Association of Chiefs of Police agrees that addiction is a public health issue and that evidence suggests decriminalization for simple possession is an effective way to reduce the public health and public safety harms associated with substance use. We cannot arrest our way out of the overdose crisis. 30 jurisdictions globally have adopted or are beginning to adopt a shift in drug policy that moves away from criminalizing people who use drugs to one of decriminalization. The Portuguese model have given evidence that when utilized along with other interventions, including harm reduction, prevention, enforcement, and treatment strategies, decriminalization has led to an increase in treatment uptake, a reduction in drug-related deaths, and no increase in drug use. In May 2021, the City of Vancouver submitted a request for an exemption from the Controlled Drugs and Substances Act to Health Canada, requesting urgent action to provide an exemption that would decriminalize personal possession of illicit substances within the city's boundary. 1 year later, the federal government has still not taken any meaningful action to advance this call for action. And as the Liberals drag their feet on this, with every passing day, more people are dying from this overdose crisis. And make no mistake, the cost of inaction is real human lives. It also creates persistent personal, social, and structural stigma against addiction, increases risk-taking, and is an impediment to public health harm reduction initiatives. For the self-proclaimed feminist prime minister, know this: criminalizing causes greater harm to women. Women incarcerated for drug offenses in BC tend to be younger and often undereducated. They commonly have a diagnosed mental disorder and a history of victimization. Incarcerated women have a higher rate of Hep C and HIV infections than men. Many are mothers. Separating children from their mother is devastating, often resulting in foster care placement. Children with parents in prison are more likely to drop out of school and become involved with the prison system themselves, thus continuing the vicious cycle. As lawmakers, it is our job to put in place policies that will help break this cycle. That's why I urge every member in this House to support Bill C-216. At least send it to committee so that we can have that vigorous debate, so that we can invite witnesses to come before us to answer some of those questions that I just heard the Liberal Parliamentary Secretary raise. Even if you don't support this motion and you have doubts about it, then do the right thing by sending it to committee and to hear witnesses about it. Aside from decriminalization, Bill C-216 also calls for the expungement of criminal records that are solely related to minor possession. A criminal record poses often insurmountable barriers for people finding employment and housing, and they should not have to wear that as a noose around their neck. We need to change our laws to allow for that. Madam Speaker, the harms caused by interacting with criminal justice system and the additional barriers posed with a criminal record throws people into a vicious cycle that often impacts the most vulnerable in our society. And that is exactly why the NDP motion also asks the government to work with provinces to develop a strategy informed by health center solutions that addresses the root causes of problematic substance use. To ensure a successful response to the overdose crisis, decriminalization must be complemented by the necessary supports. We can break this cycle today if we act with courage and compassion. So I ask the government to end the war on drugs and save lives by decriminalizing personal possession now, and the NDP motion by calling on the government to do exactly that. There can be no more delays. Madam Speaker, the time to act is now. Thank you so much.